Well, hey, Dr. Hall here, and I want to talk for a few minutes to those of you who might be interested in knowing a little bit more about how Theragel stimulates the normal healing process. So I'm going to have a little bit of science here, not a lot. It's easy to understand, so if you're not interested in that stuff, bye, have a good day. But if you're interested in that, I want to just spend a few minutes explaining some of this, because you'll understand it. Those of you who are certainly healthcare professionals, you nurses and doctors will understand this. And even if you don't have a background in this, hopefully you can understand a lot of the concepts. So we always say that Theragel helps the healing process in a natural way. So just a real brief presentation first. So Theragel's oral coating rinse. You may be new to this. So, and it's designed to keep the mouth comfortable, clean, and healthy. It does three things. Provides great pain relief without numbing the mouth. That's what people love when they have sores in their mouth. It protects from contamination, and we have microdata. I'll talk about that some other time too. I'll talk about each of these other two. But the third, it promotes optimal healing. It really separates itself from everything else, because just about everything we do in medicine and dentistry, when we treat wounds, we're slowing the healing process down. We're using wound cleansers or topical antibiotics, topical anesthetics, all kinds of the preservatives and products that we put on wounds. We're killing 10 to 100 cells of wound healing for every pathogen, for every bacterial cell. We're always slowing the healing process down. We're not doing that with Theragel. We're actually stimulating the healing process, and that makes a huge difference. That really separates Theragel from just about every other product. So I want to talk a little bit about the healing. How do we do that? And again, we have these ingredients, and we're going to be talking a lot about the mannose polysaccharides, because that's what's involved in the healing process. But Theragel is composed of 100% plant-based food ingredients and water. There are no drugs, no synthetic molecules, no animal product. It's plant-based food. And specifically, we have the mannose polysaccharides, or mannans, and we have a little xylitol. Mannose polysaccharides are carbohydrates or sugars. You can use their synonyms, so you can say sugar or carbohydrate. Xylitol is another natural sugar that is in a lot of sugar-free products, gums and candies and things like that. And the essential oils of cinnamon clove, thyme, and wintergreen, those are the natural preservatives that we have in Theragel. We'll talk about those later. Today we'll be talking more about the mannose polysaccharides and how they are involved in the wound healing process. Because we got a lot of wounds in the mouth, sores, ulcers, surgery. If you go to the dentist and have surgery, there are all kinds of times that we have the need for wound healing in the mouth. So here, mannose polysaccharides at the wound site. We've known for decades that when you have these carbohydrates at the wound site, you stimulate the macrophage. The macrophage is a big white blood cell, and it is the cell that controls the wound healing process. Whether it's soft tissue or bone, whatever. When there's a wound that needs to be healed, it's the macrophage that controls that process. And these sugars stimulate the macrophage. And when you do that, then you have enhanced healing and wound protection, because the macrophage also is a white blood cell. It kills bacteria, fungus, viruses, and does a better job of doing that too. So let's go ahead and talk about some of that. I'm going to show you two slides. Don't get carried away with these. Are simple. These two slides I'm going to talk about for the next few minutes are from a paper published in 2006 in International Immunopharmacology. I was really happy to find it back then. A couple of guys named Pt.1 and Quinn, whoever they are, but they wrote a really nice paper about how macrophages are stimulated by these sugars in nature. Because again, we've known that when you and other sugars can do this too, but it's hard to beat mannans, the mannose polysaccharides. And that's what we have in our product. So this is a slide from their paper. And it has to be a polysaccharide. It has to be a complex, big sugar. It can't just be just a monomer or just a glucose or a mannose or galactose. It has to be a polysaccharide to stimulate these macrophages. So this shows, so if you look at these, each of these little circles represents a single sugar. They're hooked together into chains to make a big, long, complex polysaccharide or a big sugar. It has to be a polysaccharide. So when a macrophage internalizes these sugars, it stimulates cytokine production, and cytokines are the chemicals that are secreted by macrophages for lots of reasons, but one of the things is wound healing. There are almost 200 of them the last I checked. This is just a handful of them, but it helps stimulate the cytokine production. If they need more cells, they'll call in more cells to come to the wound site. It also helps stimulate the reactive oxygen species production. There's hydrogen peroxide and nitric oxide. Nitric oxide was the molecule of the year, I think, in 1991 or 92, somewhere along in there. It's really been a subject of a lot of research. Superoxide anions. And I want to explain something to you. Everybody is trying to control nature. In medicine, we're always using drugs. We're trying to make things happen. We're trying to control things to make one or two things happen. So in wound care, I'm always asked by people, what do you have in your product that helps with wound healing? Is it an anti-inflammatory? And I say, no, that's not an anti-inflammatory. That's anti-inflammatory hinders the healing process. A lot of people think anti-inflammatory helps healing. No, it hinders it, because inflammation is necessary for optimal healing. Well, does it have an antioxidant effect? No, that works against the healing process too, and even a lot of doctors don't understand that. So look here. These reactive oxygen, and we usually think of reactive oxygen species, we think, oh man, oxidative species, that's bad. We take antioxidants to protect ourselves against that. Well, we do produce too many a lot of the times. We're doing things, eating things, and doing things that produce too many of these. But during the healing process, the macrophage secretes a tiny, tiny amount of these at certain times to help in the healing process. So one of the things they do is they help kill bacteria. But another thing they do that most doctors don't even know, these chemicals that are secreted, they help grow new tissue like blood vessels. So see, people are developing antioxidant products for wound care. Well, guess what you're doing? You're working against the healing process, because there are times when this needs to be secreted to help grow new tissue like blood vessels. And if you use an antioxidant from day one, you're not going to get optimal healing. We're using anti-inflammatories. We're taking all kinds of ibuprofen or non-steroidal anti-inflammatory drugs. That's going to hinder the healing process. We don't want to do that if we can. In fact, we know that these drugs now are toxic to the healing process, can actually kick us into chronic non-healing wounds. We don't want to control nature. We're trying to work with nature, and so that's an important thing to understand about Theragel. We're not controlling things, we're working with nature. So this second slide is the one I really love. It's another slide. It's supposedly a drawing of a macrophage, and believe me, the macrophage doesn't look like that under a microscope, so just pretend, okay? But they're trying to explain some things. Look here. One of the things that macrophages do to internalize, to take it into themselves, is they phagocytize these big sugars. And phagocytosis is a kind of a big word. Phagos is Greek for to eat, and cyto refers to single cells. Well, single cells, they're not like us. They don't have a mouth or a stomach and all that. They can't eat like we do. The way they eat is they think of the blob, the old movie The Blob. They envelop bacteria or funguses or dirt, or in this case, these big sugars, and they envelop them, and then this part of the membrane breaks down and they grow a membrane, and suddenly it's inside. Once they internalize, that's how they kill bacteria. Once they internalize these sugars, well, look here. Look at all these different pathways. Have you heard that word pathways before? With Aroga products? All these different pathways. It stimulates the macrophage. This is the nucleus. Don't worry about all this. And then the macrophage also uses this sugar as an energy source. Well, that's a pretty good deal. So we already knew that, but what I didn't know until I found this paper in 2006 was they've identified all these receptors along the membrane of the macrophage. Now see, we didn't know about receptors. I was talking to Dr. McAnally yesterday. We didn't know about receptors when we were in school. You know why? Because they hadn't been discovered yet. We're too old. They were learning about receptors in the 70s when I was in college and in dental school, and Bill was getting his PhD. We didn't have it in our textbooks because they hadn't discovered them yet. But the thing is, everything's a receptor-mediated event now, it seems like. But they've drawn them to look like that. They don't look like that. But these are pattern recognition molecules. So just think what that means. They're designed to recognize specific sugars. So again, they have to be complex, big polysaccharides, but the fat, and look here, there's a mannose receptor right there. How about that? And mannan polysaccharide. These guys don't know us from Adam, but this is well known now. But the thing that's fascinating is if a certain sugar comes in contact with one of these receptors, and that receptor recognizes that sugar, just the act of recognizing the sugar stimulates a macrophage. Well, I mean, who would have thunk that? I mean, that's fascinating. Just touching the sugar and recognizing it by chemical braille, because they have specific shapes and specific chemical signatures, just touching it stimulates the macrophage, and then, like everything else, phagocytosis is a receptor-mediated event. They should have shown a mannose receptor there too, because mannose receptors are very big in phagocytosis. So these receptors are important. So just touching the sugar stimulates it, and then when they internalize it, it stimulates them some more, and then they feed it. Well, that's what we're doing, okay? And this is what happens in nature. So when I'm talking to doctors who've had microbiology and studied bacteria and all that, I remind them, because I say, remember all those sugars? And so you nurses and you doctors, you know what I'm talking about. You remember when you took microbiology, all those bacteria and the fungus, and even a lot of viruses, they have sugars. I mean, think powdered donuts. They're covered with sugars all over their cells. We didn't know what those sugars were for back in my day. Again, we're kind of old and didn't know, but now they know that those sugars are involved in colonization. It helps bacteria colonize. They glue to each other and form colonies. Another thing those sugars are involved in that we know now are they use those sugars to communicate with each other. Have you ever heard of that? Sugars used for cellular communication, cell-to-cell communication. You ever heard that anywhere? Now they know that's what those sugars are for. But the point is, the bacteria are coated with sugars. So let's say you have a wound, and when I'm talking to dentists, I say you extract a tooth, you got a wound, okay? And you got a nasty environment. So you got macrophages coming, they're already there in the gum tissue, but they're coming in right behind other cells, neutrophils and other cells, in the bloodstream to that site, and their first job is to clean up. First job is protect us and keep us from dying. So we want to clean up and protect us from infection. Well, the mouth is a nasty place. I don't know if you know that or not. It's nasty. Lots of bacteria. So the macrophage comes in, they come in contact with the sugar that's coating all those bacterial cells, and when they recognize them, it stimulates them. Well, they do a better job of recognizing. So the point is, maybe they say, they come in the case of the mouth, it's so nasty, they say, and I'm paraphrasing here because I really don't know what macrophages say, but there's something along the lines of, holy moly, we got a lot of bacteria here. So they'll send signals, they'll communicate, and they'll send signals to the spleen and bone marrow to call in more cells to come to the site to help fight the battle. They'll do a better job, they do a better job of phagocytizing. They're stimulating, they're doing a better job of killing the bacteria. And then when they get around to it, they do a better job of wound healing. So think about it. The bacteria, the macrophage is stimulated by the bacteria, and then they eat the bacteria and use the sugar to stimulate it, and there's this energy source. I mean, it's almost like somebody designed this. I mean, who would guess? So that's what happens in nature. You've always heard me say we're working with nature. Well, that's what we're doing. When you put Theragel on a wound, we're introducing the mannan. And look here, there's a mannan receptor. Mannans recognize other sugars too, and there are 2 and I think 3 other of these receptors that recognize mannose as too. So mannans are very important. We use mannans because you can't beat mannans in wound care. So we're just working with nature. We're introducing the mannans. They're stimulating the macrophage, we're feeding the macrophage, but they're not connected to bacteria. We don't make them have to kill bacteria. We're just feeding the macrophage, stimulating the macrophage the way they're designed to be, then we back off. And we're not telling the macrophage to stop secreting these reactive oxygen species when they need to be secreting them. We're not telling it to stop the inflammatory process when it's not time, like we're doing when we're using drugs, because all we can do is screw things up. It's just the way it is. We're just feeding it, stimulating it, and backing off and letting it go to town and bumping it up a notch or two. And boy, if you want reproducibly great healing results, you can't beat working with nature, and that's what we do. And I'm proud of it. So I hope that explains that a little bit. So we're working with nature. Now I'm just going to show you really quickly just some results of studies that have been done around the world, really, with Ace Mannin through the years. This was a study done really quickly, and this was back in the 80s, with Bill's very, very first product. You know, all those patents that Bill has, his very first product was a wound gel. And this was done in Puerto Rico in the 80s. They took guinea pigs and gave them third-degree burns because third-degree burns are bad, obviously, for people. Infection, they die, and healing and all that. So they had 4 groups. They used they used a constant pressure and temperature and also equivalent wounds, and they divided in 4 groups. Nitroglycerin is a standard of care still today. It's a drug. It's a topical drug, an antibiotic, and it's silver sulfadiazine. It's still used today. Then aspirin cream. They thought aspirin might help wounds heal faster, and then they used Bill's first product. They thought that aspirin might speed the healing process up, but this is the story. Here's the standard of care: 47 days for healing to take place in third-degree burn versus 30 days, when every day can be critical to your survival. That's huge. That's huge. This is standard of care still being used today, and this is what Bill's first product was, and our new stuff's better because Bill, we've learned a lot in the last 35, 40 years. But that just shows you. I used to get calls back in 90, 91. I was getting calls. I got calls from 3 burn units. In about a 2-year period, they had read this article, they were using this product, and they wanted to know what the heck is Ace Mannin. So I'm explaining to them, and I asked them what the results, and they said, we've been using this product. We're able to do graft procedures days sooner than we ever have before. One was a pediatric hospital. Those are fun phone calls, just so you know. Well, that was Bill's first product. Our new stuff's better even. But that shows you Ace Mannin. It also shows you that they don't learn anything because they're still using silvadene. This was a study in animals. Canine in this case means dog, not canine tooth, and they surgically caused frications. See, the macrophage controls healing of bone too, remember, as well as soft tissue. And so they caused bone loss in the mouth, on the jaws, and it significantly increased bone and cementum and periodontal ligaments, the soft tissue. That's really big in periodontics, or the gum disease. That was a study for gum disease. Bone healing. This was done with human beings. I'm running through these real fast for you, but they extracted lower third molars, lower impacted wisdom teeth on human beings. On half of them, they had them rinsed with Paradex, the gold standard that I talk about, the gluconate, the chlorhexidine gluconate product that's considered the gold standard antimicrobial rinse. The other half, they put Ace Mannin in their jaws, and then 3 months later, sent them home. 3 months later, they brought them in, did radiographs, did x-rays. The radiographic density was 50 to 90% greater in the Ace Mannin treated. So better wound healing, fast and bone healing in the Ace Mannin group, which is very significant. This was they did this in rats, and they actually, the roof of the mouth, they took tissue and used, and it simulates when a periodontist is doing a gingival graft, and they take the donor side out of the roof of the mouth, and then they put it there. That hurts, and it takes a while to heal. They had faster healing, secretion of various growth factors, type 1 collagen, enhanced reading papillary pegs. Some of you heard me say that not only do wounds heal faster, they heal stronger. Type 1 collagen and enhanced reading papillary pegs, to those who understand wheeling, that tells you something. Not only are wounds healing faster, they're healing stronger. That's very important when you're trying to get things, especially in the mouth, when you need to get back to eating as quickly as you can, and you're challenging those tissues. So anyway, the point is, the faster you get a wound healed, the faster you're addressing pain, and the faster you're reducing the chance of infection. So wound healing is very important. Theragel, people love Theragel because they get pain relief. I'm big on that too, but I'm big on the wound healing. And so I just wanted you to understand a little bit about what's going on. We're working with nature. We're not trying to control nature. we're letting nature go to town, and we're just helping it. So for a cleaner, healthier, and more comfortable mouth, you want to use Theragel. So hopefully I hope it was interesting. I love talking about it. It's fascinating to me, but hopefully you'll understand that and you can have a better idea of what we're doing. We're working with nature and we're getting faster healing. So thanks a lot.